Assalamualaikum doctors. In this video I am discussing how can we manage inflammatory bowel disease, that is both Crohn's disease and ulcerative colitis. So first, what are the investigation we can do for both Crohn's and ulcerative colitis? That is lab for acute attack, full blood count, inflammatory marker ESR and CRP, fecal calprotectin, alkaline phosphatase, that is liver function test, urea and electrolyte and creatinine, drug level if on medications. So for chronic complications, iron profile, ferritin and vitamin B12 level, ophthalmology for slit lamp examination, ECG for pericarditis. And we can do a biopsy, endoscopy biopsy for both. And abdominal x-ray for if toxic megacolon, CT or MRI abdomen, if arthritis x-ray, ultrasound if needed, and abdominal ultrasound for gallstone or strangulations. So again, the investigation for both ulcerative colitis and Crohn's disease, that is IBD, full blood count we are doing, inflammatory marker ESR and CRP we are doing, fecal calprotectin, then alkaline phosphatase, liver function test, urea and electrolyte plus creatinine, drug level if on medications. For chronic complication we are doing iron profile, ferritin and vitamin B12 level, ophthalmology for slit lamp examinations and ECG for pericarditis. We can do endoscopy and biopsy and abdominal x-ray if we think toxic megacolon complications, CT and MRI if arthritis x-ray, and ultrasound if needed, abdominal ultrasound for gallstone and strangulations. Now, what are the multidisciplinary team I will involve? That is gastroenterologist, hepatologist, ophthalmologist, rheumatology, liaise with the school, psychological support, physiotherapy and dietitian. So again, the multidisciplinary team are we are involving my pediatrician, gastroenterologist, hepatologist, ophthalmologist, rheumatologist, liaise with the school, psychological support to the family, physiotherapy and dietitian. Now I am telling the treatment of Crohn's disease. Treatment of Crohn's disease is the induction of remission. First line are if fast presentation or single exacerbation in 12 months. So first line are glucocorticoid, enteral nutritions. If there is a concern about the growth or side effect of steroid, and rectal budesonide if have one or more distal ileal, ileocecal or right-sided colonic disease, and conventional glucocorticoid are contraindicated or if person cannot tolerate them. Aminosalicylate if corticosteroid are contraindicated. So first line we are giving glucocorticoid, enteral nutrition, glucocorticoid, enteral nutrition, amine, rectal budesonide, aminosalicylate, and if not response, then second line or add therapy. If there is second or more exacerbation or glucocorticoid dose cannot be tolerated, then we can give azathioprine, 6-mercaptopurine, methotrexate if azathioprine or mercaptopurine is not tolerated. Third line are biological treatment we are giving infliximab and adalimumab. And maintenance and remission by azathioprine or 6-mercaptopurine and methotrexate. Treatment of complication of Crohn's disease are abscess or fistula, we give ciprofloxacin and metronidazole. Surgery indicated if abscess not responding to antibiotic, toxic megacolon with colonic dilatation more than 6 cm, and perforation, full treatment without response. So mainly Crohn's disease treatment I am telling. First line we are giving that glucocorticoid, enteral nutrition, aminosalicylate, rectal budesonide. Second line we are giving azathioprine, mercaptopurine, methotrexate. And third line are biological agent adalimumab and infliximab we are giving. And we maintain the remission by azathioprine or 6-mercaptopurine and methotrexate. And treatment of complications are abscess or fistula. For abscess or fistula, we are giving ciprofloxacin and metronidazole. Surgery if indicated. If there is toxic megacolon more than 6 cm in diameter, abscess are not responding to the antibiotic treatment, and perforation, these are. What is the ulcerative colitis treatment we give? Treatment of ulcerative colitis is that mild to moderate cases, topical aminosalicylate, oral aminosalicylate, add to therapy topical oral corticosteroid. Okay. Mild to moderate we are giving topical aminosalicylate, oral aminosalicylate, and add on therapy that topical oral corticosteroid. In severe cases we are giving IV steroid, IV cyclosporine or consider surgery. Severe cases IV steroid, IV cyclosporine or consider surgery. And infliximab. Maintenance of remission by topical aminosalicylate, oral aminosalicylate, azathioprine, mercaptopurine. So ulcerative colitis we are giving first liner topical mild to moderate topical aminosalicylate, oral aminosalicylate or steroid if not working. Then if severe case IV steroid we give, and IV cyclosporine, or infliximab. Maintenance of remission by topical aminosalicylate, oral aminosalicylate, azathioprine, or mercaptopurine. There are some questions they ask. First of all, what are the type of anemia the patient suffer? That is normocytic, normochromic of chronic disease, macrocytic anemia for vitamin B12 deficiency, microcytic hypochromic anemia for iron deficiency, and autoimmunohemolytic anemia. So types of anemia are normocytic, normochromic of chronic disease, macrocytic anemia for vitamin B12 deficiency, microcytic hypochromic anemia for iron deficiency, and autoimmunohemolytic anemia. Jaundice in Crohn's disease. Jaundice in Crohn's disease are primary sclerosing cholangitis, autoimmune hepatitis, drug toxicity, especially methotrexate, gallstone, and infective hepatitis. So jaundice, why Crohn's disease jaundice occur? First of all, methotrexate drug, sclerosing cholangitis, hepatitis, autoimmune hepatitis, drug toxicity, especially methotrexate, gallstone, and infective hepatitis. Why abdominal pain occur in Crohn's disease? Abdominal pain are first of all cholangitis, gallstone, disease activity, autoimmune hepatitis, renal activity, pancreatitis, and gastritis from steroid. So abdominal pain in Crohn's disease are cholangitis, gallstones, disease activity, autoimmune hepatitis, renal activity, pancreatitis, gastritis from the steroid. And causes of arthritis are disease, its nature, and steroid side effects. We give that steroid card bracelet can be used and follow up regular. So this is the inflammatory bowel disease management. Crohn's disease, ulcerative colitis, commonly common exam. Thank you.